Hello everyone, welcome to Parenthood. This is Eugene Pediatric Associates Baby 101 class. I am Dr. Pilar Bradshaw and I am so happy for you that you have your gorgeous new baby. As you've already discovered, newborns are a lot of work and you should be congratulated because you've made it through an exhausting first month and things are going to get easier soon. Please remember that your pediatricians, behavioral health experts, and social workers at Eugene Pediatrics are truly here to help you 24 hours a day, 7 days a week. Just give us a call at 541-HUG-KIDS if you have questions or concerns. Today's class is designed to address common concerns about 1-month-old babies, and I really want you to save up and ask your questions. One of the big concerns about 1-month-olds is how can I soothe my baby? It's important to know that bonding helps drive your baby's emotional and physical development, and it's also part of what drives you to get up in the middle of the night, to learn to understand your baby's different cries, and to provide your baby with that endless love, protection, and care that is your specialty as a parent. You cannot spoil a 1-month-old baby, I promise. Please go ahead and hold your baby as much as you can. Your warmth, your familiar smell, all of those natural comforts make your infant less fussy. You can also gently massage your baby. Touch calms babies and speaks to your infant without words. Also try talking, singing, or reading out loud to your baby. Your baby was born loving the sound of your voice. Many parents ask, why is my baby crying? Remember that crying is the only way your baby can communicate with you right now. When you respond to it, you teach your baby to trust you. Don't let your 1-month-old baby cry it out. It is normal for babies to cry for 2 to 3 hours each day, and some babies even cry more. Some cry less. Your baby might cry because they're hungry, tired, or need a diaper change, or for what seems like no reason at all. Let's drill down on some reasons that babies cry at this age. If your baby is hungry, try feeding, even if they just ate. It's normal for babies at this age to eat very close together at times. Sometimes your baby cries because they're gassy. Make sure your baby isn't swallowing too much air while feeding, and after each feeding, it's time to burp. Hold your baby against your shoulder, upright in your lap, or face down across your lap and gently pat or rub your little one's back. If they haven't burped within a few minutes, you don't have to keep trying. Sometimes babies cry because they're due for a diaper change. Change your baby's diaper even if it's just a little wet. Some babies really cannot stand having a wet diaper. It might be that your baby is cold, so place your baby skin to skin for the quickest warm-up, or swallow your little one in a snuggly soft blanket. Sometimes babies cry because they're too warm. If your baby's skin feels warm, take off some layers of clothes, especially the hat. Babies lose a lot of heat from their head, so removing the hat can help. If a baby is still hot after 10 minutes, check your baby's temperature. Your little one might have a fever, and that is an emergency phone call to our office. Sometimes you'll notice that your baby is crying because they're so tired. Just wrap your baby up in a blanket and try rocking them to sleep. Babies can also cry when they're lonely. Just picking them up and cuddling them near your heart can help that kind of crying to stop. Babies can also cry because they're tense. Walk or rock and hold your baby. Take your baby for a ride in a car or stroller. Put your baby near some white sound like running water, soft music, or white noise maker, or you can try singing to your little one if they're tense. Lots of parents have questions about breastfeeding. Breast milk is all the food your baby needs for at least the first 6 months. We encourage all new parents to breastfeed if at all possible. Even some breastfeeding is better than none. If you can, breastfeed your baby whenever they appear hungry. For the first few weeks, that may mean every 1 to 3 hours, day and night. Each feeding may last from 15 to 60 minutes, depending on whether your baby is awake and hungry or kind of sleepy. Your newborn should feed 8 to 12 times every 24 hours until they're back to their birth weight, which usually happens by 2 weeks. After that, you can start to compress feedings mostly into the daytime. Don't introduce a bottle of breast milk until nursing is well established. That's usually around 4 weeks of life. Please refer to our website for details on safe storage of breast milk. Let's go over some of the benefits of breastfeeding. Benefits for your baby include that breast milk gives your baby all the nourishment they need for the first 6 months of life. Breast milk is easier to digest than formula. Breast milk lowers your baby's risk for many types of illnesses in the future, such as ear infections, diarrhea, asthma, and diabetes, to name just a few. Breast milk reduces the risk of obesity later in infancy and during childhood. And breast milk also reduces the risk of SIDS, sudden infant death syndrome. Breastfeeding also has benefits for you as the mom. Breastfeeding supports and strengthens your bonding with your baby. It helps your body recover from the rigors of pregnancy and childbirth. Breastfeeding may make it easier to lose pregnancy weight. Breastfeeding lowers your risk of developing certain health problems such as breast cancer, ovarian cancer, rheumatoid arthritis, and diabetes. And breastfeeding is easier than preparing a bottle. Many parents choose to formula feed their baby. Infant formula can also give your baby the nutrition they need to grow up healthy and strong. If you plan to feed your baby both formula and breast milk, we do recommend waiting for 4 to 6 weeks, if possible, before introducing formula to build your body's capacity for milk production. Babies do digest formula more slowly than breast milk. If you're not breastfeeding at all, your baby might need fewer feedings than a baby who nurses. Feed your baby 2 to 3 ounces at each feeding at this age. It won't take long for you to be able to sense whether your baby is still hungry or full at the end of a bottle. Be sure to follow your pediatrician's instructions if your baby has a special feeding plan. Warm your formula by setting the bottle in a bowl of warm water. We recommend not heating up formula in the microwave because it can easily burn your baby's mouth and throat. When should you worry about feedings for your 1-month-old baby? This is an important topic. You should worry and call us 24 hours a day if your baby is vomiting every feeding or projectile vomits across the room on a frequent basis. You should worry and call us if your baby is eating more than 6 ounces in a feeding or eating less than 2 ounces in a feeding for a 1-month-old. Also, if your baby is tiring out and cannot eat after a few minutes, you should call us. You should also be concerned if your baby cries throughout a feeding or if they show poor weight gain at your pediatrician's office. Something that's important for all parents of young infants to remember is sleep on the back, play on the tummy. Sleeping on the infant's back is important for supporting your baby's safety, and it reduces the risk of SIDS, sudden infant death syndrome. Babies should sleep on a firm, flat surface designed for babies, like a bassinet or a crib. Tummy time strengthens your baby's neck and core muscles, but it must be done while the baby is awake and under continuous adult supervision. 1-month-old babies should spend 3 to 5 minutes a few times a day on their tummy. The chest-to-chest position often comforts a baby during tummy time, and it does count as tummy time. Remember some very important tips about sleep safety. Always put your baby down to sleep on her back. Use only a firm, flat surface designed for infant sleep, like a bassinet or crib. Please use only cribs or bassinets that meet current Consumer Product Safety Commission standards. That means don't use secondhand or garage sale cribs or bassinets. Those may not adhere to current safety standards. Don't place anything in the crib with your baby, such as bumpers, blankets, or toys. Be sure to avoid inclined sleepers and positioners. There are many of them sold on the market. They aren't safe. If the baby's chin can fall to her chest, it will cut off her airway, or she could roll out of an inclined sleeper. Never leave your baby sleeping in a car seat for long periods of time. And if you are going to be on a long trip, make sure an adult is in the back watching the baby's head and neck. Let's talk about umbilical cord care. It's normal for the umbilical cord stump to change from yellow to brown or black. Once it darkens, it should fall off on its own, usually by 2 weeks of life. Avoid pulling or tugging at the umbilical cord to remove it. Do watch for the following signs of infection around the cord stump. Call immediately if you notice redness and swelling at the base of the cord where it meets the abdomen, bleeding with more than a few drops of blood, yellow or pus-filled drainage, or a foul odor. If your baby's umbilical cord stump does not fall off within 4 weeks, please let us know. Nail care and baths are a big time for babies and parents. Trim your baby's nails as needed to prevent him from scratching himself. I like to use an emery board. Less often I use clippers or small scissors because you might cut the skin, so be really careful. Baths can be a daily part of the bedtime routine, but you may decide to only bathe every few days as long as you always keep baby's face, hands, and bottom clean. Let's talk about constipation and spitting up in 1-month-olds. Babies may only pass stool once a week. As long as your baby is not fussy, spitting up often, or passing hard clay-like stools, that is perfectly normal. It's also normal for young babies to grunt and strain to pass a soft stool. But if the stool is hard, babies should be given a 1/4-inch piece of glycerin suppositories into their rectum and see their pediatrician. Consult our office if mucus or blood is seen in your baby's stool. Spitting up occasionally is normal, but forceful vomiting, also known as projectile vomiting, is not normal and needs to be evaluated if it happens more than once. Let's talk about baby safety. Always support your newborn's head. Your little one is strong, but those tiny neck muscles will remain weak for the first few months. They don't get good head control until 4 months of life. Also, use a car seat that meets the National Highway Traffic Safety Administration's safety recommendations and make sure it's installed correctly before you leave the hospital. Keep your environment smoke-free at all times. Always lay your baby down to sleep on their back. And never leave your child alone on a bed, sofa, or changing table, not even for a few seconds. Let's talk about some common newborn conditions. First, let's talk about colic. Does your baby have regular episodes of crying that begin around the same time each evening, last a few minutes to a few hours, and are difficult to soothe? That might be colic. Colic can be upsetting and exhausting, but it usually does stop on its own within 3 months. Cradle cap. Your baby might develop thick, scaly patches on their head called cradle cap. It's usually harmless and goes away on its own within a few months, and until then, you can try a few home treatments, including applying mineral oil to the scalp an hour before bath time, washing your baby's scalp with a gentle, mild shampoo, or using a soft toothbrush to loosen the scaly patches before rinsing. Also common is eye discharge. If the discharge is clear, carefully wipe your baby's eyes with a soft, clean washcloth with warm water. If it's yellowish or greenish, it may be an eye infection, and you should bring your baby in for an appointment or call us. Let's talk about nasal congestion. Many babies make noise when breathing. If your little one is very congested, try saline drops. Place 3 to 4 drops of saline in one nostril and then suction it softly with a rubber bulb. Repeat in the other nostril, or use a cold mist humidifier. That can help your baby breathe easier. Don't add anything to the humidifier, and don't use rubs or patches on a newborn baby. Umbilical hernias are also common. That's when an umbilical area pushes outward when the baby cries. Most close on their own and no treatment is needed. The hernia skin should be soft when your baby is relaxed, but if your baby is inconsolable or the hernia stays very hard, see us right away. There are some conditions that need your pediatrician's attention. Prolonged jaundice. This common newborn condition causes the skin and the whites of the eyes to appear yellow. By 1 month, your baby should no longer be visibly yellow. Please call your care team if you think your baby still has jaundice. Also, eye infections. Call your care team if you notice signs of an eye infection in your baby, such as swollen eyes, red eyes, or yellowish-greenish discharge from the eyes. Thrush is also common. White patches on your baby's cheeks, gums, or tongue could be an infection called thrush. Your baby may refuse to eat or develop a severe diaper rash. If you're breastfeeding, you can also get thrush. Signs of thrush include red, scaly nipples and pain during or after nursing. Thrush is common and easy to treat, so call your care team if you think you or your baby might have it. And finally, fever. A temperature of 100.4 rectally or higher is a fever. In a 1-month-old baby, that deserves an immediate call to your pediatrician's office. Postpartum depression is common, and it's something we should all be talking about. Postpartum depression is more than just the baby blues. Please call your OB, midwife, or pediatrician if you think you might have postpartum depression. This is the #1 complication of childbirth, and it is absolutely nothing to be ashamed of. Postpartum depression or psychosis symptoms can include severe anxiety, extreme sadness, frequent or uncontrollable crying, severe mood swings, extreme anger, feeling easily overwhelmed, intense feelings of shame, inadequacy, or guilt, inability to bond with your new baby, poor sleep even when you have a chance to sleep, significant trouble concentrating, hallucinations, depersonalizations, paranoia, or agitation. Let's review when to call us urgently. Please call Eugene Pediatric Associates at 541-HUG-KIDS immediately if your newborn has a fever of 100.4 degrees or higher, won't eat for extended periods of time, several hours or more, projectile vomits often, has fast labored breathing or nasal flaring where the nose flares like a bunny, if the baby looks unusually pale or yellow-skinned, or if your parent intuition tells you to worry. We consider the following a medical emergency and recommend a 911 call if your baby is grunting with every breath, is listless, lethargic, and won't respond to you, is gray or blue or white in the lips or tongue. That ends our Baby 101 class slides. This is Dr. B. It's been great to talk to you today about your new baby, and now we would love to answer your questions.